little bit since I'm short here. My name is Mia Raven. I am the Director of Legislative Affairs for Alabama Reproductive Rights Advocates. I'd like to touch on what was mentioned earlier. Abortion clinics are made to be ASC, which is surgical centers, as required by HB 57, the TRAP law that was passed a couple of years ago through the state. Since moving to the Sparkman location...
McClendon here, we need him in hell.
Sorry.
Go ahead. I'm sorry. Go ahead.
That's okay. Since moving to Sparkman, there have been no protests by the pro-choice side. We don't have to protest on the pro-choice side because the other side cannot get to the women to try to talk to them, yell at them, intimidate them. And that's basically what it boils down to. And it's highly offensive to me as a woman, and I know very many other women in this room, that people are equating abortion clinics, which are healthcare centers that do more than abortion, such as pap smears, cervical screening camps for cancers, just a myriad of other things that happen to have with reproductive rights. Equating them to sex offenders is just, it's disgusting. It's really disgusting. I find it kind of funny that the other side wants to claim that, the kids are going to be, held up to these things and be seeing these things when they themselves have been bringing children to the location on Sparkman Drive, which is the new clinic. This picture was taken in November 24th of last year. Not only that, but there are other anti-abortion groups that are now targeting high schools and junior high schools with giant 6-foot signs. This is ridiculous. This is not our side doing this. I can only speak for the Montgomery Clinic. We have no problem whatsoever with protesters on our side because we have a non-engagement policy. We do not talk to them. Our only concern is the patients. The other side used to bring the gory signs and all that, but we basically shamed them and stopped bringing them when they were on Madison Street because they were next to the Blunt House, which is similar to a Ronald McDonald House, where people who have patients in Huntsville Hospital can go and stay. And now they're screaming that they're going to start bringing these gory signs back unless they get their way. Nobody would know this clinic was even there if it wasn't for them with these signs outside. It's not like we have a neon sign that says abortion clinic here over the building.
Ms. Raven, your 3 minutes are up. If you'd like to finish, go ahead and close, please.
Okay. Well, number one, our side has never perpetrated violence against anyone. And number two, we have bigger and better fish to fry in the state. We need to get our budget in order, and if this bill passes, it will be litigated.
Thank you. Any questions, any committee members? Thank you very much. Next, Ms. Parcell. Is that correct? I may have the name wrong.
Percival.
Percival, okay.
Hi, my name is Sandy Percival. I'm the founder and president of Montgomery Humanists. We are an official chapter of the American Humanist Association, a national organization. We believe that the best decisions are made with logic, reason, and compassion, none of which are addressed in this bill. HB 527 only further stigmatizes women's health care and will increase the teen birth rates in the state, which is already in the top 10 in the nation. Let me clarify. This bill does not target all reproductive health care, only that which would lower teen birth rates. Without access to reproductive health care, which includes sex education, condoms, and birth control, women and teenage girls in Alabama will resort to drastic and unsafe measures. This, like all restrictions on women's health care, endangers the lives of Alabama women. Representative Henry and Senator Sanford have both said that their reasoning for proposing this bill was to protect children from the graphic, vulgar, and inappropriate harassment of the patients by so-called pro-life fanatics. If passed, this bill sets the precedent that vulgar protests can shut down businesses and organizations. For instance, if the KKK were to protest at a community center located near a school, the community center would have to be shut down. This bill is unconstitutional. It is a waste of taxpayer dollars, and it reinforces the idea that a lot of individuals have that Alabama is the most ignorant state in the nation when it comes to women's health. This bill will be challenged in federal court as unconstitutional, and our tax dollars, my tax dollars, should not be wasted defending it. There is nothing vulgar or offensive about women's health care. In fact, it is a personal and private matter that is not displayed outside by either the clinic staff or the clients. And as Ms. Raven just said, we also have no protesters on our side of the issue. The only thing offensive at Alabama reproductive clinics is the protesting on the other side of the issue, which means this bill is clearly aimed at the wrong entity. Patients and providers value discretion in reproductive health care. If we are to ensure that children are not exposed to graphic images and hateful rhetoric, this bill is the wrong way to do that. Protesters can and have been known to hold those disgusting signs outside schools where there's no clinic nearby, and have even enticed children to participate in their protests. HB 527 will not only fail to protect children, but it will hurt Alabama women and cost the state of Alabama money it does not have to defend yet another bill that is so blatantly unconstitutional.
I would ask you to wrap up, please. Your 3 minutes is up. I'm sorry you're limited, but with 5...
This is my last sentence,
okay.
And this is a very big deal to me, so I'm sorry if I'm a little frazzled. The state of Alabama does not have the money to defend yet another bill that is so blatantly unconstitutional. Representative Henry should be ashamed to have proposed it. If 2,000 feet is a safe distance from a threat, it should be the distance at which we keep protesters from both schools and abortion clinics.
Thank you. Any questions? Any committee members? Thank you very much. Ms.